right, welcome to Acupuncture, Not Just Needles. I am Dr. Brendan Fegan. I'm an acupuncturist, doctor of Chinese medicine, and I will be talking about acupuncture, of course. So here at Align Modern Health, we are an integrative medicine clinic. We do all of these things here you see on the slide: acupuncture, functional medicine, nutrition, clinical massage therapy, chiropractic, physical medicine. We work integratively, so if you come for really anything, we should be able to help you out. We like to work with each other as well. So if you see a chiropractor, maybe you'll see a massage therapist or an acupuncturist. If you see functional medicine, maybe you see acupuncture as well. It works really well to work together like this. Now, from the point of view of acupuncture, like in its countries of origin, the acupuncturists would do pretty much all of these things, not everything to the same degree that they would do it here, but we would dabble into all of these things together. They like to say that Chinese medicine is a stool with three legs. One leg is acupuncture, one leg is herbal medicine and nutrition, and the third leg is physical medicine. Here in the US, particularly in Illinois, physical medicine is done by chiropractors and physical therapists, and us as acupuncturists, we're really doing more of the acupuncture and related modalities, as well as the herbal medicine that we'll talk about. I am Dr. Brendan Fegan. I'm an acupuncturist here, doctor of Chinese medicine here at the West Loop Clinic. I got my doctorate and master's of acupuncture and Oriental medicine at Bastyr University in Washington and Seattle. Part of that training was, I worked at the local hospital there, which is actually what Grey's Anatomy is based on. The Harborview Medical Center is the inspiration for that show. I also have a number of months of training in China, in Hangzhou and Shanghai, so Pudong Hospital, Longhua Hospital, Zhejiang Provincial University of TCM. And earlier before that, I have two bachelor's degrees from Michigan State University, social relations and policy and comparative cultural politics. Professionally, I treat a lot of pain management, particularly sports medicine, headaches, migraines. Those respond really well, very reliably, predictably. Neurological disorders like stroke, paralysis, MS. Some of those things can't be cured, but they can be improved. Dermatological conditions, eczema, psoriasis, a whole host of other types of conditions as well. Lots of things that we can do with Chinese medicine. So traditional Chinese medicine is a genuinely holistic approach that looks at the interaction of systems within the body, and in every case to determine the correct course of treatment. TCM nurtures channels in the body which must be free of obstruction. This obstruction causes the disease and can be either internally generated, for example, from improper diet, too much alcohol. Emotions can cause internal obstruction, or externally acquired, which would be like a pathogen, external trauma, that kind of, any kind of like an injury. And we free the channels of obstruction to promote health and longevity. All of the modalities within TCM serve to restore normal flow within the body's channels and include, but are not limited to, acupuncture, cupping, gua sha, moxibustion, and herbal medicine. I think it's important to understand with traditional Chinese medicine that it is a synthesis of traditions, of traditions from China and elsewhere too, not just China, Japan, Korea, Vietnam, a little bit of Greek medicine, that is ancient Greek medicine is incorporated into there. But it's a modern approach. So we have definitely a big basis in conventional medicine, physiology, anatomy, et cetera, that influences or guides some of our approaches. And when we are making a diagnosis, the interaction of systems is really important. So we're looking at not just, where's the pain, how's the pain, but what other kinds of signs and symptoms we see in the body that will indicate what kind of system is out of balance. Because really what we're looking at is functional relationships between the organs, and then also how those organs or those relationships reflect in the body and along the channels. Acupuncture. Acupuncture is the main modality for which we are known. Acupuncture refers to not just the modality of using the needles, but also is increasingly used to identify the entire scope of the medicine. So oftentimes when people say acupuncture, they may be referring to traditional Chinese medicine as a whole. In the US, it's become kind of a catch-all for everything that we do. Acupuncture is an evidence-based practice has been scientifically proven over thousands of years to help to correct imbalances in the body caused by external factors such as stress, toxins, and injury. Through the strategic insertion of hair-thin, flexible needles into points on the body, acupuncture promotes blood flow, stimulates the body's inbuilt healing mechanism, relieves pain and inflammation, and reduces stress. Common conditions that we treat: physical pain, stress, anxiety, depression, migraines, neurological disorders, allergies, men and women's health, fertility, fatigue, GI disorders, insomnia, all within any given month, we'll probably see all of those, somebody with all of those, or a person with one of those, right? Many times throughout the month. Physical pain, sports medicine responds really, really well, really easily, predictably, reliably. Migraines as well. Anytime that we get the body into a healing response, typically your stress is going to be reduced. I mean, a big part of modern life is that the sympathetic nervous system is overreactive, overstimulated, and it's harder to heal when you're in that kind of state. So whenever we relax that system in the body with acupuncture, you will feel relaxed, sleepy, you'll heal faster. A big part of what we're doing with acupuncture is we are stimulating the body, guiding the body to heal specific areas through the insertion of the needles at the acupuncture point. And this causes the body to heal properly. Because we want the body to heal properly, not just heal, right? We don't want to heal, just have a bunch of scars. We want to heal so we have full function. A lot of people think that the acupuncture needle may be painful, or they're kind of afraid of needles. But if you look at this graphic here on the lower right hand of the screen, you'll see a comparison of the size of the needles. An acupuncture needle, the thinnest needles are about as thin as your hair. Even if you use a thicker needle, about 100 of those will fit into a medical syringe. So the syringe that you would get a shot with is about 100 times larger than the acupuncture needles we're using. Acupuncture needle is also solid rather than hollow. If you look at the medical syringe, you can see there's a hollow tip there. Because they need to inject a fluid that will actually kind of tear the skin, whereas an acupuncture needle basically just kind of goes through it. So it's really more of a pin rather than a needle. And when we are when we are doing acupuncture, we're treating the acupuncture point. Points are a kind of offhand way to describe what we're doing, but there really isn't an acupuncture point. There is an acupuncture point area or a probability of where the best point is going to be. Think of it as like if you're fishing in a river or a lake, you can catch fish anywhere in the lake, but there are going to be some areas of the lake where you catch the bigger fish more often. And that's kind of what an acupuncture point is. And the fish is the effect on the health condition that you're using. So using the correct pattern of acupuncture points, the correct stimulation, you can get some pretty amazing results. And at the very least, improvement in whatever symptoms that you're coming in for. Cupping. So Michael Phelps did us a great job, or a great service with getting all the cupping for the Olympics. I think it was 2 Olympics ago. Cupping is a modality where we create a vacuum in a vessel applied to the surface of the body, causing the body to tumefy or swell into the vessel, and produces therapeutic petechiae or red spots. Not everyone gets petechiae. It's very common for it to happen, but some people, they just get a little bit of a discoloration that kind of goes away. And I'll kind of explain the differences there in a second here. Petechiae are extravasated blood cells, or cells that have been forced from the capillaries and moved into the fluid-filled spaces between the capillaries and cells. When the body breaks down these extravasated blood cells, the byproducts have anti-inflammatory and pain-relieving effects. Cupping vessels can be made from many materials, including animal horn, earthenware, bamboo, plastic, rubber, silicone. Most commonly nowadays is glass. They'll either use fire cupping, where you create a fire, you put it into the cup and put it onto the body, or like what we use here at Align, we use the the pneumatic valves. We have a little suction cup, put it on there so there's no fire or risk of getting burned. Sometimes called the opposite of massage, cupping lifts the muscle, tissue, and fascia to relieve tightness and tension, whereas massage manipulates soft tissue by applying pressure. Cupping can benefit physical pain, very much so, stress, anxiety, muscle tightness, tension, and can help with athletic performance. Particularly if you're an athlete and you're feeling, oh, your joints are stiff, or you have kind of a pulled muscle, but it's not quite painful. Maybe your range of motion is a little bit limited because of stiffness you're feeling. Cupping will very much help with that kind of scenario. A lot of times what's happening is that there's a thin layer of connective tissue that goes around all of the muscles and joints and ligaments and everything. Sometimes if you have external injury or just overwork the muscle, it can become inflamed and squish that connective tissue together, in which case the microcirculation does not get through properly. And it kind of gets the friction, and so that's why it feels stiff and stuck. When you apply the negative pressure of the cup, it actually lifts that tissue away and the circulation will restore itself. And that's also why you will get some petechiae. So for example, in Michael Phelps' case, he had a lot of very dark spots, primarily because he's an athlete and he's exercising so frequently. There's a lot of blood and metabolic waste products in his muscle. So when he's getting the cupping done, it's going to look darker. Typically, it's what we see too if somebody has a long-term muscle tension or muscle problem. When we do the cupping, it's going to be darker. And as we do more and more cupping, as a person gets better, the marks get lighter and lighter and lighter, to the point where sometimes people will actually make a little bit, their body will adapt, produce more capillaries, more circulation to the area. Now, the anti-inflammatory effect that's happening is not just from increased circulation to the area, increased oxygenation to the area, but also because when the blood cells are metabolized by the body, they release heme. Heme is what carries the oxygen molecule throughout the body, and heme is a very potent anti-inflammatory. So if there are other types of inflammation going on in that area, the cupping can help. Cupping can be used for other conditions rather than those kind of the muscle pain that we typically use it for. For example, people may use it to get rid of toxins, quote unquote, but really the most common thing we're using cupping for is some sort of physical pain, muscle pain, and most people do like the way it feels, and so they can use it for stress or to calm down, make their muscles feel better. Gua sha, not road rash. So gua literally means to scrape. Better translated as to press stroke. If you're trying to actually scraping anything away. We're not scraping this, skin away or anything like that. Sha, the inner part of the second character, means sand and is a reference to the petechiae or dots that arise as a result of the press stroking. Press stroking is performed with a tool often made of animal horn, stone, jade, acrylic, porcelain, or metal, unidirectionally in repeated strokes with a regular rhythm in order to cause a therapeutic experience of petechiae and increase microperfusion, which is the flow of fluid between capillaries and tissues, which improves the exchange of nutrients, gases, and metabolic waste. In many ways, gua sha and cupping serve a similar purpose. They are done a little bit differently. Gua sha is better able to get into, around joints, in between muscles, areas that you wouldn't be able to cup because of the geometry of the body, where a cup wouldn't stick on or would be too big. Gua sha often is used, along the fascial plane, so along the connective tissue plane, or kind of like if you ever see somebody who's really muscular, where you can see kind of lines between their muscles, that's a lot of times is where we're going to be doing the gua sha. That's where we're going to get a lot of the petechiae. We can relieve or release adhesions with gua sha, which is going to be a little bit more difficult to do with cupping. Can be done with cupping, but gua sha is going to be more common for that. Gua sha you may also hear as scraping or Graston method, I believe is what some other people may call it. So it's done by a wide range of people. It's very effective for certain kinds of pain. We also can use it for colds. So especially in China, you'll see people who, if they have an upper respiratory tract infection, they'll get gua sha done on their back. And it's a basically way to stimulate the immune system, release endorphins. They'll feel better after doing it. Gua sha and cupping both are common treatments in traditional medicine around the world. So, I mean, we do this a lot in traditional Chinese medicine, but it is found elsewhere where they'll use, animal horns or porcelain teaspoons, or even like some people will use coins to do gua sha for headaches or for colds. Just like cupping, use this a lot for physical pain, muscle tightness, tension, and to improve athletic performance. Certainly, if you have a muscle cramp, getting acupuncture, doing some gua sha in there, get more circulation, release adhesion, you'll feel quite a bit better after that is done. Moxibustion. Moxibustion is one of my favorite therapies to use with Chinese medicine. Moxibustion comes from the Japanese word mogusa, a loan word from a common name of Artemisia vulgaris, or mugwort, a plant that grows all around the world in riversides and ditches, and that is then harvested, dried, and ground to varying degrees of coarseness for medical use. So Artemisia vulgaris grows here in Chicago. It grows basically in any ditch that you see. You'll probably will find it. You don't know what it is, but that's what it is it's growing there. A lot of the mugwort we use is either Artemisia vulgaris, which is the European mugwort, or it is the Artemisia argi, which is the Chinese mugwort. They're very similar function. To produce it, you take the plant, you dry it, and then you grind it into a powder, and then you shake out the powder. So what's left is this kind of like a fluffy material. And that is what is used as the moxa is compressed into little cones. And there are varying degrees of the moxa based on how much powder or how much plant material is still left. So the highest degree of moxa has been processed quite a bit and looks and smells different than the coarse material. When we're using it, the moxa is ignited and then either held over the area to draw blood and fluids to a local region, barrel packed to flush congestion away from an area, or used directly to heat specific acupuncture sites or points of pain. Aligned Modern Health most often uses pole moxa, which is like a stick of the herb. Sometimes it's carbonized, so it produces a little bit less smoke. Ibuki moxa, which is what I prefer to use, is a stick, like a sticker that sticks onto the acupuncture point and burns down. And direct moxa, which is a very, very fine fluff that we put directly onto the skin, and then as soon as it gets a little bit hot, we take it off. My preference is the Ibuki moxa. That's a nice happy medium between the two different kinds. I don't use the pole moxa all that much. You can use it, you can use, for example, pole moxa, you can go across along the meridian rather than just one acupuncture point. Moxa used for physical pain, particularly nerve pain. I found nerve pain responds pretty well to acupuncture, or even gynecological issues will respond well to the moxibustion. Weakness, lethargy, menstrual concerns, acid reflux, digestive problems, irritability, anxiety, and dizziness. One of the things scientifically we found with moxibustion is that the smell itself, the smoke, contains a number of constituents that help improve a person's mood, as well as are strongly antibacterial, antiviral, anti-inflammatory, and pro-circulatory. So the smoke itself is very effective. If you've ever seen somebody sage a room to remove negativity from it, that they're actually doing something very similar to what moxibustion is doing. And historically, moxibustion was used before the invention of needles. So the acupuncture point system, the meridian system existed, and then people discovered they could burn moxa, or essentially sage the acupuncture point to get a therapeutic effect. Some of the things that we can do with moxa are pretty amazing. They kind of defy good explanations, even though they do work. So, for example, like turning a breech baby is something that is a traditional indication for moxibustion. When we're doing the moxa, we often will use it for somebody who's feeling fatigued or whose immune system is a little bit low. It's a good way to tonify the digestive system as well. Reduce dizziness, yes, we'll do a moxibustion like on the feet, for example. A lot of things we can do with moxa. It smells a bit like incense or like a campfire. And one of the, I would say, the only better explanations for how it's working is that as the moxa burns down, it causes the body to think it's being burned. And so it releases heat shock protein at the acupuncture point. Acupuncture points typically contain higher concentrations of mast cells and immune cells, which are inflammatory or pro-inflammatory, anti-inflammatory. And by releasing the heat shock protein, it causes a number of different types of effects on the body. And because the body is not being burned, all of that kind of healing energy goes to the acupuncture point and goes to the network the acupuncture point is connected to, and that causes the improvements in the health and well-being of the person. Herbal medicine, my favorites. Herbs, which may include different parts of plants, such as leaves, roots, stems, flowers, and seeds, are combined into formulas and administered as teas, capsules, tinctures, or powders. I think another good thing to mention here is that the Chinese word yao, herb, really means a medicinal substance. So there are some things that we call Chinese herbs that are actually like a mineral, for example, like gypsum, well, we don't use fluoride, but a number of other different kinds of minerals, calcium carbonate, for example, like Tums, are sometimes used in the production of the herbal formulas. Now, considered when creating formulas is the basic compatibility or incompatibility of each herb. This is typically, compatibility or incompatibility is based on the observation of the individual herb's effect on a person. So two herbs that cause loose stools may not be used together, where you might use one that causes loose stools and one that dries it up, because they complement each other and counteract each other's side effects. The specific dosage of each herb, any restrictions, prohibitions, and or counter interactions. So this is not only the herbs with each other, the herbs with a person's allergies, or the herbs with a person's other supplements or medications. There are some medications that interact with herbs. And if you're going to get herbal medicine, you definitely want to mention that whatever medication you're taking to your herbalist, they'll be able to know what to do and what not to do. And then the needs makeup of each individual patient. Something that's important to understand is what we're treating here, especially with the herbs, is we're looking at not just the condition a person comes in for, but also their constitution specifically. And so it is the interaction of those two that creates the treatment strategy. You could have 10 people all with the same condition, but with different constitutions, and they're all going to get different herbal formulas. So everything is individualized for each person. Every formula is highly customized and developed specifically to the needs of the individual patient, which is, again, unlike Western pharmaceuticals, which is kind of, they go for more of a silver bullet type approach, where this worked for 10 people, so it should work for the next 10 people. Whereas what we do is we treat the person over the disease typically. Herbal medicine may benefit digestive concerns, blood circulation, insomnia, sleeplessness, seasonal allergies, inflammation, swelling, viruses, and bacterial illness. All of these, we can treat quite a lot of different things. I think one of the most amazing things I saw with herbal medicine when I was studying in China was, I wasn't treating them, I was watching them being treated. Saw maybe 30 patients who had myasthenia gravis. They basically were paralyzed. And then after 6 months to a year of treatment, they were all able to walk, talk, run, bowel movements and everything were fine. It was a pretty amazing turnaround for a lot of these people. So what we're doing with herbal medicine is the more complex modality of traditional Chinese medicine. If you were to go to China and go to the hospital there for any reason, the bigger thing they're going to give you is the herbal medicine over the acupuncture. Acupuncture is going to be used mostly for pain, stroke, paralysis, tinnitus, where herbal medicine is going to be used for everything else. It's very effective. You do have to take, it doesn't taste very good, but that's just kind of part of the game, really. We can treat many things with herbal medicine. Yeah. All right, so that is just a brief rundown of all the different modalities we have from traditional Chinese medicine and acupuncture. If anybody has any questions, feel free to put them into the box here. I think I see a couple. Okay, so first question is, do you perform dry needling acupuncture? Thank you for asking that. Dry needling is a type of acupuncture. So it isn't basically my opinion on dry needling, because I'm an acupuncturist, dry needling is acupuncture done by somebody who doesn't want to be an acupuncturist. So they aren't getting all of the training that you would otherwise need to become an acupuncturist to do it. So dry needling is effective for certain conditions, for pain conditions, for certain types of like muscular spasm, for example. It's basically you put in the needle and then you stimulate it pretty aggressively to cause the muscle to fatigue itself. So we do that, but there are, in most cases, better options than doing dry needling. So we can do a properly tailored acupuncture program, particularly with electrical stimulation or with the cupping or the moxa or whatever else we may need. Typically is going to give you better results, more long-term results than dry needling itself. So, and I would say, again, for dry needling should create a solution within 1 or 2 visits. It should not be something that you're going to have to do more than a couple times for the same issue. And the other question is, what kind of effect would moxibustion have on MS? Moxibustion would be something that we would use for MS. There's a lot. MS is complicated, so there's not going to be just one type of treatment, but moxibustion definitely would be indicated for that. All right. If there aren't are there any other questions? Oh. Okay, so we have a question about ALS. ALS is again something that's degenerative, and that's something that you're going to have to ask or consult with an acupuncturist and herbalist for. So theoretically, you could get some results, but you're kind of, because of the nature of the disease, really you're limited to trying to improve the quality of life of a person. Is moxa painful? No. So moxa is not painful. You may feel a warm or burning sensation, a pinchy sensation, but you won't get burned. Yeah, you won't get burned. So that's it. Some people may feel, oh, it's kind of hot, and then we just take it off. So yeah, it's not painful. Okay, what kind of credentials would a certified acupuncturist have? And what would someone look for to validate someone's claims of being a certified acupuncturist? So the best thing to look for is that they should be NCCAOM certified. NCCAOM is the National Board Organization for Acupuncture Certification. So if somebody may claim they do acupuncture, but they don't have that, maybe they aren't, maybe they are, but NCCAOM requires, continuing education, requires board exams, et cetera. That is what you want to look for. That is what will determine if they are an acupuncturist. They also should have a licensed acupuncture title. So that's the legal title that allows them to perform and to do acupuncture services. How long is a typical acupuncture session? So the first session here at Aligned is going to be about an hour and a half. We are going to do a half hour of intake and exam. And then we'll have about an hour of treatment. So after that first session, the acupuncture session may only be about 45 minutes is kind of the minimum. It takes about 20 minutes for the signal from the acupuncture to go throughout the whole body. And I found that results are better if you give them a little bit longer time. So 45 minutes is kind of the minimum that I'll do. So 45 minutes to an hour for a typical acupuncture session. And that will include not just the acupuncture, but also any moxibustion, cupping, gua sha, lifestyle or nutritional counseling that we may do. All will be included in that. Yes, we are in network with most healthcare plans. Yes, we are. So a question about relief for essential tremors. Essential tremors is something else that you can get at least temporary relief from. Some people will get longer term relief, others will kind of have to come back and forth, but it's you should get some change with those. So we have a question about psoas tightness and pain that can be addressed. psoas tightness and pain sometimes is better, or sometimes it will help to get physical therapy as well, some stretching, because the psoas is a muscle that's inside of the body and is difficult to access by any means. We can needle it directly, but we're probably going to be trying to needle it more indirectly, actually. Yes, I do perform oxybustion, and can you provide herbal supplements? So all the herbs that we provide are classified as herbal supplements. I like to describe them as, if you have drugs on one side and food on the other, the herbs are kind of right in the middle. Some of the herbs are actually food, like dates or goji berries or cinnamon, and some are should not be used as food. They have to be used as directed. But officially, they are all classified as herbal supplements. We can prescribe other types of supplements as well. So we may prescribe, magnesium or vitamin D or something like that if it's indicated. Have I seen relief for TMJ with acupuncture? Yes, I have seen that. TMJ is another condition where often the problem is actually stress. It's stress related. So if you can address the stress, then the person will feel better. But if you can't address the stress, then yes, we will help release the muscles that are there, and you'll get some relief. Thoughts on ear seeds? We do use ear seeds. Ear seeds are basically they're a small pellet or like a seed, hence the name, or a gold or silver pellet that is then put on a sticker and put into the ear. There's a lot of different acupuncture points in the ear, and by having a sticker there provides that acupressure, and the patient can then press it whenever they want throughout the day or for a couple of days. They're a nice little stopgap measure, or a nice thing to have people take home with them. Yeah. So we have some questions, like teeth grinding and knots in your back. The answer both to those is yes. So knots in your back is going to be basically any type of, like the physical medicine type of treatment that we're doing. You are going to feel better with that. Cupping is going to be really helpful, especially the type of cupping called running cupping, where we move the cup along the back. You will feel better with that. Teeth grinding is going to be, again, usually stress related. It's going to be very similar treatment to the TMJ. So if you can address the stress in the person's life, and this is up to the person, right, up to the patient, then you'll feel better. But in lieu of being able to get rid of all the stress, then yes, we can help with that. And which of these treatments do you think is best for shortness of breath and asthma? So if I treat this a lot, so I treat asthma a lot. I treat also like post-COVID syndrome a lot. And what I found works the best is to do all the modalities. So it's to do acupuncture and moxibustion, possibly cupping or gua sha in certain parts of the body. And then we would also give a person herbal medicine for a longer term type of treatment for that, to help support the constitution and get rid of what other symptoms they are having. Okay, so that looks like the end of the questions. Thank you all for joining. And if you have further questions, or if you want to see, have a 15-minute consultation, we have our phone number right there on the screen. The consultations are free. You're also welcome to stop in and say hi to any one of our acupuncturists, and we'll be able to help you out there too. So thank you all so much for coming. Again, I'm Dr. Brendan Fegan, acupuncturist here at the Dr. Chinese Medicine here at Align Modern Health in the West Loop. Thank you.